Provide privacy. Hi there, my name is Jill, and I'm going to be your student nurse today. Can you please tell me your name and date of birth?
Samantha July 25th, 1991.
All right. Samantha, are you allergic to any foods like medication or latex?
No.
Well, I'm here to do a head to toe assessment today. It'll take probably 20 minutes. Is that a good time?
Yes.
Is there any reason I shouldn't use this time to do a blood pressure?
Something just that you're not going to be my patient.
And Cassandra can find my pulse.
You have 0 pulse.
She can find
You have
it?
0 respirations.
She's on a pulse ox, so she's on a pulse.
You have to take the pulse manual.
Yeah, it's manual pulse. It just has 0
I
pulse.
have it.
You could end it there, really, while she's down.
I did her complete. She's dead. Time of death. Call it 5.
Right, so blood pressure was 104/68, right arm supine position. Pulse ox is 98% on room air. Temperature is 97.9 degrees Fahrenheit. Respirations were 10, regular rate and rhythm. And pulse was 68, regular rate and rhythm. On a scale of 0 being no pain, 10 being the most excruciating pain you've ever felt, what's your pain today? 0. All right. The first thing I'm going to do is just look at your skin. I'll look at your legs. I'll have you sit up for a second. Look at your back. Alright, so skin is appropriate for ethnicity. It is actually cool to touch. Bruising was noted on left elbow-ish, mid-forearm. I don't see any tattoos at this moment. And piercings is noted in bilateral ears. Temperature was smooth. And there's no other lesions, rashes, anything to that nature. And there's no tenting noted. I think I got edema too.
If they have tattoos, do you have to say where each
There's
one is?
no edema noted. Was there any tenderness on palpation? No. There's no tenderness noted. Yes. You need to note tattoo placement. Okay. I know you've already told me your name, but can you tell me your full name again?
Samantha Doolittle.
And where are we at today? Dermisal nursing, and approximately what time of day is it?
Morning.
All right, so my patient is alert and oriented to person, place, and time. Her speech is clear and understandable. Her face is symmetrical. Can you give me a smile and a frown and puff those cheeks? Great, so cranial nerve 7 is intact. I'll measure your pupils, just look straight ahead. You want to look at the wall there for me, please? Now look at my pen. Great. Now follow my pen with your eyes only, not moving your head. Okay, so pupils are 3 millimeters. They're equally reactive to light and accommodating with consensual reaction. Cranial nerves 3, 4, and 6 are intact. Eye movement was smooth with no jaggy movement. No, just smooth is fine. It's been a weekend since I've done this last. Tumbling. So open your mouth for me. Say ah. So buccal mucosa is pink and moist. Gums are pink and moist. Teeth are present and intact. Uvula and soft palate does rise midline. Tonsils were probably a 2+. I don't know if I just say that.
What did you say? Tonsils what?
2+, but I don't think you guys need to mention tonsils.
It could be uvula rising midline.
Midline.
I assume you would
Lips
say-
are pink and dry.
You would say that the tonsils were there too, I assume.
You could, I mean, that's what I noticed. But if you don't, I don't think you have to even mention tonsils. But if you're actually looking at the mouth,
That's what I'm saying.
you might as well notice it. But you won't be counted off if you don't. Did I hit everything on that?
Probably trachea.
Trachea is midline. All right, I'm going to have you sit up and swing your legs towards me, please. I'm just going to watch you breathe. So chest rises and falls evenly and symmetrically. There's no use of accessory muscles or retractions. There's no pursed lip breathing, no nasal flaring. There's no cyanosis noted. So I'm going to auscultate your lung fields. If at any time you feel dizzy, please just let me know. And I'm going to ask you to breathe in and out through your mouth. I'm not really going to have you do that. I'm just going to go through spots. So 1, 2, 3, 4, 5, 6. Raise your right arm for me, please. 1, 2, 3, 4. 1, 2, 3. No. You need to actually listen to each spot. 1, 2, 3, 4, 5, 6, 7, 8. And it should be on the skin. So lung fields were clear. There's no crackles, wheezing, or rubs noted. Resonance is percussed throughout all lung fields, or posterior lung fields, not all. Are you having any chest pain or tightness?
No.
Are you having any shortness of breath?
No.
Do you have a cough?
No.
Okay. And do you tire easily?
No.
Okay, good. Just caught up on the questions I forgot to ask. So carotid pulses are 2+. They are equal bilaterally. No bruising noted upon or auscultation of carotids. Aortic. Herbs point.
You just say when you try.
Tricuspid and mitral. S1 and S2 are heard at each landmark. There were no murmurs noted, so I'm not going to use my bell. Hold your hand that way for me. Palpating the posterior tube.
Do we need to identify when we give her?
Yes.
Which,
So radial, posterior tibial pulses and dorsal pulses were all at 2 plus equal bilaterally. Capillary refill was less than 2 seconds. On upper extremities was probably like 4 down here because your feet are very cold. And there was no edema noted upon palpation. Okay, I'm going to have you lay back down for me, please. Are you having any abdominal pain? Yep. Any changes in appetite? Any problems with nausea, vomiting? Diarrhea, constipation? Any problems with urination? No. Okay. So I'm inspecting the abdomen, so I'm going to lift your gown and look. So the abdomen is flat, it is symmetrical. I don't notice any masses present. I'm suspecting there's probably an epigastric pulse, which is tiny. And that's it. I would auscultate on skin, on skin. So there's active bowel sounds in all 4 quadrants. I'm going to have you raise your knees up for me, please. And please let me know if you feel any pain, any tenderness, or palpation. Okay, so there's no pain or tenderness upon palpation. And tympany is percussed in all abdominal fields. Alright, so are you having any joint pains or stiffness? Alright. So what we're going to do is perform some range of motion exercises. So if any time you don't feel like you can perform the movement, just let me know and we'll stop. Okay. I'm going to have you actually swing your legs over here. So no pain or anything in your neck? Okay. So what I want you to do is first put your chin to your chest and then look at me. And then back, and then look at me, and then turn. Look at me, to your right, to your knee, to your shoulder, and your shoulder. Alright, now push on my hand. Good. Push back. Good. Side, and side. So we have a full range of motion in the cervical spine, and strength is 5 out of 5. So I'm going to have you put your hands like this, and push them to your shoulders, and then bring them down. Roll them over. Okay, so and then put them like this, and push against me, and pull. So there's a full range of motion in her elbows, and strength was 5 out of 5. Now on your lower extremities, I'm just going to ask you to bring your feet out and put them back. And push against my hands, and pull. So full range of motion on her knees, and strength is 5 out of 5. Now put your toes to the ground, and now I'm going to come straight up. I'm going to do a full circle. Push up on my hands, and then push down. Great. So there is a full range of motion in her ankles, and her strength is 5 out of 5. That concludes our head to toe assessment. So I'm going to have you lay back down, get you all comfortable. There's your call light. I'll put your bed in the lowest position. And let me know if you need anything. Okay. Goodbye.